Beneath the surface of everyday medicine lies a billion-dollar illusion. Sometimes, all it takes is a small tug on a single thread, and the entire system starts to unravel. That's exactly what happened when I set out to research something as simple as dog allergies. I inadvertently stumbled into a rabbit hole, and what I found were highly alarming truths about the origins of Big Pharma. The deeper I went, the darker it got. I learned that Big Pharma isn't just about medicine. It's a meticulously crafted empire built on power, control, and obscene profit. And the craziest part? Even your doctor might be completely unaware of how it all began. When John D. Rockefeller, oil tycoon, member of a so-called elite bloodline, who still holds the title richest man in American history, discovered the gold mine potential of synthetic drugs, that's when everything changed. He realized, unlike natural herbs and remedies, synthetic chemical compounds could be patented and sold for massive profit. And that's when Big Pharma was born. Not from a passion for healing, but from the pursuit of monopoly, control, and unimaginable wealth.
The growth of a large business is merely a survival of the fittest. John D. Rockefeller, 1839 to 1937.
Rockefeller's wealth was mainly built through the Standard Oil Company and reached almost unimaginable heights, making him a billionaire by early 20th century standards. His influence was so vast, his wealth would still dwarf that of modern billionaires when adjusted for inflation. His fortune peaked at nearly $900 million in 1912, which would be equivalent to hundreds of billions of dollars today. In fact, his immense wealth actually led to the creation of anti-monopoly laws in the U.S., since his company, Standard Oil, controlled over 90% of the oil market at its height. This was something I stumbled upon while researching this article. And believe it or not, those laws are still in place today. Newsflash, they're not working. Back then, most medical practices were made up of homeopathic therapies, natural herbal remedies, nutrition education, and chiropractors. Synthetic medicine was still in its infancy. And you can't put a patent on an herb or a natural remedy that comes from the earth, which I mean is kind of ironic, because most synthetic drugs are actually made up of herbs and minerals, literally from the earth. Since Rockefeller's ultimate goal was to completely dominate the medical and pharmaceutical industry, he had to discredit the homeopathic quacks in order to bring his vision to life. He became friends with Andrew Carnegie, a steel industry tycoon and one of the wealthiest people in the world. Rockefeller was later introduced to Abraham Flexner, an American educator, definitely the lesser known of the three men, but it was actually his work that led to Big Pharma's domination and takeover of the medical industry. In 1908, Flexner published a critical assessment of the state of the American educational system entitled The American College: A Criticism. That report caught the attention of the Carnegie Foundation, and he was asked to join their research staff. He then went on to visit 155 medical schools in the US and Canada, doing on-site evaluations, interviewing faculty, examining facilities, and assessing curricula. His findings were published in the 1910 Flexner Report, also known as Carnegie Foundation Bulletin No. 4. Commissioned by the Carnegie Foundation, the report was presented to Congress, who acted on its conclusions and wrote them into law, leading to major legislative changes in medical education. The report pushed medical schools to implement tougher admission and graduation standards and to strictly follow mainstream scientific protocols in their teaching and research. It emphasized the need to completely revamp and centralize medical institutions. It also concluded that the U.S. had way too many medical schools, producing too many doctors. This led to the closure or merging of many schools, and some universities even reverted to male-only admissions to shrink the student pool. Many American medical schools failed to meet the standards promoted in the Flexner Report. Schools of electrotherapy, homeopathy, traditional osteopathy, eclectic medicine, and physiomedicalism, which used untested botanical therapies, were heavily criticized. Some practitioners were even jailed. The Flexner Report completely transformed the nature and process of medical education in America. It resulted in the elimination of natural medicine schools and established the biomedical pharmaceutical drug model as the gold standard for medical training. Sadly, many aspects of the present-day American medical profession stem from the Flexner Report and everything that followed in its wake. Or shall we say, culling. In the late 1800s and early 1900s, there were all kinds of natural medicine schools: homeopathic, osteopathy, naturopathic, eclectic herbal medicine, diet, midwifery, steam baths, and more. Both allopathic and naturopathic medicine coexisted. But Rockefeller and Carnegie changed all of that. They created a monopoly, eliminating any competition that threatened their brand of medical training. They wanted to establish a single approach by capturing the medical education system, which was all about teaching patented pharmaceutical drugs as the only way to cure illness. The American Medical Association, or AMA, was founded in 1847 by a physician named Nathan Smith Davis. It was heavily funded by Rockefeller and Carnegie. Together with the AMA, they took it upon themselves to reform medical education in America, specifically targeting and shutting down the larger, respected homeopathic colleges that didn't comply with the Flexner Report. They immediately began pouring hundreds of millions of dollars through their tax-exempt foundations into medical schools that were teaching drug-intensive medicine. For over a century now, the Carnegie and Rockefeller Foundations have shaped the medical education curriculum through their grants and donations. And this is exactly the problem when the money is coming from a source that has a vested interest in the outcome. Side note: you might want to look up how many medical and educational institutions the Rockefeller family founded. It's pretty interesting. If you follow the money, you'll see that many organizations not directly established by them still received major funding from the Rockefellers, which was key to their creation, growth, and influence. The Flexner Report of 1910 was a setup. Flexner was hired and paid by Rockefeller and Carnegie through the AMA to publish his report with the primary goal of denouncing and eliminating the competition. And it worked. The Flexner Report was crafted to support the vision that Rockefeller and Carnegie had for the medical industry, claiming that most medical schools were not teaching sound medicine, which in their eyes meant that natural health colleges were not promoting enough chemical drugs manufactured by them. To ensure medical schools fully embraced pharmaceutical drugs, they made it a condition that one of their staff be appointed to the school's board of directors in order for the school to receive grants and donations. They justified this by saying they just wanted to ensure the schools were spending their money correctly. If the school wanted the money, it had to comply. Then they began filling the school's boards of directors with their staff members, who were on the donors' payroll. In return for the grants and donations, they required the schools to teach exclusively pharmaceutical drug-oriented courses, with no emphasis on natural medicine. Once that was in place, the pendulum swung in favor of the Rockefeller-Carnegie Big Pharma agenda, and it has remained that way ever since. By 1925, over 10,000 herbalists were out of business. By 1940, more than 1,500 chiropractors had been prosecuted for practicing quackery. The 22 homeopathic medical schools that flourished in the 1900s dwindled down to just 2 by 1923. By 1950, all schools teaching homeopathy were closed. If a physician did not graduate and receive an MD degree from a Flexner-approved medical school, they could not find a job anywhere. This is why today, medical doctors lean heavily towards synthetic drug therapy and know very little about the natural healing properties of nutrition and natural cures found in nature. As a result of the Flexner Report, medical researchers' primary focus is on the development of new pharmaceutical drugs to treat illnesses. Medical schools don't teach students about nutrition because it's considered a natural cure or remedy. One doctor even noted receiving just 1 hour of nutrition education in medical school. A doctor can't write a prescription for natural food or herbs because natural cures found in nature cannot be patented. This is why medical students spend countless hours learning about patented medicines, because the medical schools receive substantial subsidization from the drug companies, which in turn pay the medical professors. Consequently, professors teach medical students about the latest pharmaceutical drugs, and later on, the physicians get paid by the pharmaceutical companies to write prescriptions for their patented pharmaceutical drugs. The drug lobby is one of the most powerful and well-funded lobbying groups in the US, spending billions to protect its interests, from keeping drug prices high, to extending patent monopolies, to shaping regulatory approvals. And you better believe it's a top priority to keep physicians writing prescriptions. But it doesn't stop there. Pharmaceutical companies also funnel massive amounts of money into political campaigns, buying influence and skewing policies in their favor. So when it comes to legislation, it's not public health being protected, it's profit. Medical doctors don't get paid to educate people about natural cures. And sadly, by the time they graduate, they are thoroughly indoctrinated into the pharmaceutical approach, knowing very little about natural remedies. The entire medical field has been skewed towards pharmaceutical drugs, which can be patented and produced at great profits. The pharmaceutical industry, fueled by capitalism, has systematically ignored the healing power of nature. But that's no oversight. It's the business model. Because to Big Pharma, wellness doesn't generate revenue, sickness does. And that's the sad reality. Although highly toxic and often deadly, chemotherapy became the standard treatment for cancer patients in the 1940s. It's worth noting that the American Cancer Society, founded in 1913 and funded by John D. Rockefeller, emerged around the same time Big Pharma was introduced. Whether there was an actual rise in cancer cases or simply an increased awareness is unclear, but cancer remains one of the most profitable illnesses globally, raising questions about the motives behind this industry's growth. After analyzing the history and evolution of the medical profession, it's clear that the pharmaceutical industry has had a massive influence over it. What's wild is that so many doctors today are completely unaware of this history, or how deeply Big Pharma has shaped their field. The COVID era was a wake-up call for a lot of people. Not only did it spark widespread questioning of the mainstream medical narrative, but it also exposed just how profitable pharmaceutical control can be. Big Pharma raked in tens of billions of dollars from the COVID shots alone, solidifying their grip on the system, all while silencing alternative voices and censoring discussion. But here's the silver lining. People are waking up. There's a growing awareness across the population, and many doctors are finally open to discussing the potential of natural remedies. Across the US, we're seeing a resurgence of interest in herbal medicine, holistic therapies, and integrative approaches to healing, and it's long overdue. The web of Big Pharma was spun long ago by the Rockefellers in shadow, one strand at a time. They ensnared the regulators, the educators, the healers, their backers and supporters, just insects caught in the web. Now the web trembles. The spider is here. They cannot escape. But the question is, can you? By writing this, my hope is to awaken more people to the historical and ongoing influence of Big Pharma, to spark curiosity, and a return to what heals us naturally. With greater awareness and education, we can build a future where nature becomes the norm and pharmaceutical intervention is the last resort.